Out of everything in Medicare, Part D might be the one people underestimate the most. It's prescription drug coverage, and most people either assume they don't need it, assume it's automatically included, or just don't think about it until they're standing at a pharmacy counter getting a surprise bill. This video is going to fix that. I'm Robin Dall, independent Medicare broker and educator at RobinsWisdom. No call centers, no 1-800 numbers, just straight answers. Let's get into it. Part D is Medicare's prescription drug coverage. But here's where people get tripped up. It's not automatically included in Original Medicare. Original Medicare covers hospital and medical care, but it does not include broad outpatient prescription coverage, which is what most people think of when they think prescriptions. That's what Part D is for, and you have to add it. There are two ways to get Part D coverage. If you stay on Original Medicare, you add a standalone Part D plan from a private insurance company. If you choose a Medicare Advantage plan, drug coverage is usually bundled in, but not always. So this is something you always want to confirm before enrolling. Part D plans are offered by private insurers, companies like Humana, Aetna, United Healthcare, WellCare, and others. Medicare sets the rules and approves the plans, but the plans themselves are run by these private companies. Now, every Part D plan has three main cost components: a monthly premium, an annual deductible, and cost sharing when you pick up your prescriptions. And this is where people make mistakes. Because those costs can vary a lot from plan to plan, depending on your medications, your pharmacy, and how the plan is structured. Which means choosing the right Part D plan isn't just a detail. It actually has a direct impact on what you pay all year. Here's a word you're going to hear a lot with Part D: formulary. All that means is the list of drugs your plan covers. And this is where things get more important, because every Part D plan has its own formulary, and they are not all the same. A drug that's covered on one plan might not be covered on another. And even if it is covered, how it's covered determines what you pay. That comes down to tiers. Most formularies are divided into tiers, usually 4 or 5. And in general, lower tiers cost less and higher tiers cost more. Generic drugs are often placed on lower tiers with the lowest cost. Higher tiers usually include brand name or specialty drugs, and those can get expensive, even with coverage. But here's what catches people off guard. Plans can change their formularies every single year. A drug that was affordable last year might move to a higher tier this year, or even come off the formulary entirely. The drug didn't change, the plan did, and that can have a direct impact on what you pay at the pharmacy, which is why this next part matters. You should never just automatically renew your Part D plan without checking it. Every fall, during the annual enrollment period, you want to review your plan and make sure your medications are still covered and still on a reasonable tier. Because what worked last year might not be the best plan for you this year. This is the part I really need you to hear, because this mistake is expensive, it's avoidable, and for most people, it follows you for the rest of your life. If you don't enroll in Part D when you're first eligible and you don't have other creditable drug coverage, you will pay a late enrollment penalty. And in most cases, that penalty stays with you for as long as you have Medicare drug coverage. Here's how it works. For every month you go without creditable drug coverage, Medicare adds 1% of the national base beneficiary premium to your Part D premium. That number resets every year, but your penalty is based on how long you went without coverage. So let's make that real. If you go 24 months without coverage, you're looking at roughly a 24% surcharge added to your premium every single month. Not once, not temporarily, every month. And I've seen this firsthand. People walk in with penalties of $40, $50, $60 a month every month because they assumed they didn't need Part D when they first enrolled. Now, here's the good news. This is completely avoidable. Even if you take 0 medications right now, you can enroll in a low-cost Part D plan. Some plans are very inexpensive, sometimes under $10 a month, depending on your area. That small monthly cost protects you from a penalty that can follow you for years. So don't think of Part D as something you only need when you take medications. Think of it as protection, not just for your prescriptions, but against a mistake that can cost you every single month going forward. So what if you're still working and you have drug coverage through your employer? Does that protect you from the penalty? The answer is it depends. It comes down to whether your coverage is considered creditable. Creditable coverage simply means your employer's drug coverage is expected to be at least as good as standard Medicare Part D coverage. If it is, you're protected from the penalty while you stay on that plan. But here's the part most people overlook. You should receive a notice from your employer or plan telling you whether your drug coverage is creditable or non-creditable. And this matters more than people realize because that notice is your proof. When you eventually leave your employer coverage and enroll in Part D, you may be asked to show that you had creditable coverage so you don't get hit with a penalty. So when you get that notice, don't ignore it. Don't throw it away. Keep it somewhere safe. Now, here's where this can become a problem. If your employer coverage is not creditable, which is less common, but it does happen, then every month you go without Part D counts against you. And that penalty clock starts running, which means in that situation, you should seriously consider enrolling in a Part D plan, even while you're still working, because once those months add up, you don't get them back. Here's something most people don't realize, and this is where a lot of people get it wrong. You should never choose a Part D plan based on the premium alone, because the plan with the lowest monthly premium can actually end up costing you a lot more over the course of the year. Why? Because what really drives your cost isn't just the premium. It's how your specific medications are covered, your drug tiers, your deductible, your copays at the pharmacy. All of that matters. So here's the right way to do it. You don't guess. You run your medications through the system. Medicare actually gives you a tool to do this, the Plan Finder at Medicare.gov. You enter your exact medications, the drug name, dosage, and how often you take them, and it shows you the estimated total annual cost for each plan available in your area. That number includes your premium, your deductible, and your expected copays. That's the number you compare, not just the monthly premium. Because here's what this looks like in real life. A plan with a $15 premium could cost you $2,000 a year once you factor in how your medications are covered. A plan with a $40 premium might only cost you $800 total because your drugs are on lower tiers. Same person, same medications, very different outcome. And that's why this matters. And one more thing, don't set it and forget it. You should review your Part D plan every year because plans change, drug coverage changes, and your medications may change. What was the best plan for you last year might not be the best plan for you this year. Now, this is the part most people don't know yet. Starting in 2025, Medicare made a major change to Part D. There is now an annual out-of-pocket cap on covered prescription drugs. In 2025, that cap is $2,000. In 2026, it increases slightly to $2,100. And here's what that means in real life. Once you reach that limit in a calendar year, you don't pay copays or coinsurance for your covered Part D drugs for the rest of the year. Before this change, there was no true cap. People on high-cost medications, cancer treatments, MS drugs, rheumatoid arthritis medications, could end up paying thousands, even tens of thousands of dollars in a single year. That's what this change fixes. This is a major improvement, especially for people with expensive or ongoing prescriptions. But there's an important detail you need to understand. This cap only applies to covered drugs on your plan's formulary. If a drug isn't covered by your plan, what you pay for it does not count toward that cap. So again, the plan you choose matters, because even with this new protection in place, your coverage still determines what actually counts. So that's Part D, what it is, how the formulary works, the penalty you absolutely want to avoid, how to choose the right plan, and the new out-of-pocket cap that protects you from catastrophic drug costs. The next video tackles a question I've been getting a lot lately. Drug prices are going down, so do you even still need Part D? It's a great question, and the answer might surprise you. That one's up next. And if you have questions about your specific Part D options, your medications, your current plan, whether you're in the right one, that's exactly what I'm here for. Head to RobinsWisdom.com and request a free Medicare review. No call centers, no 1-800 numbers, just Robin Dall, Medicare educator, and commissioned remote online notary. Here to make 65 feel a lot less overwhelming. I'll see you in the next one.